mommy.
Let's take a nice deep breath in and out.
I'm a chiropractor. My wrists, my shoulders, my low back from bending over patients. Of course I'm gonna have some injuries. So I need to get some self-love in those areas. I love this stuff. Okay, see, my power's turning on.
So how you feeling about the doctor today?
I'm excited. It'd be nice to get some sort of relief.
Yeah,
it makes me a little nervous. Can it be worse?
Not gonna lie.
Yeah, I know it does.
I'm here for you, boo.
I know you are. I'm Lindsay, and I have Šarko-Mari-Tutovom syndrome, also known as CMT, a form of muscular neuropathy. It is a progressive hereditary disease. My brain doesn't tell my lower extremities how to properly grow and function. So it's from elbow to the tip of my hand, you can kind of see, and then from my knee to my toe. The older I get, the more I have to use different things. So just have to use this cane now, and that's only within like the last 3 or 4 years.
You ready? You want to finish the walk?
Yeah, let's do that. Yeah. The pain is awful. It's absolutely awful. A lot of times I'll wake up in tears.
How's this ground to walk on?
It's not bad.
Yeah?
No.
Man, it's so beautiful.
Yeah. This is something I will have my entire life. And the older I get, it gets a little worse kind of every year. So I would go anywhere that I could just to be able to get, you know, some release. And somebody suggested a chiropractor.
My wife is not a complainer. It's an amazing thing because I know daily she's struggling. I will do whatever, you know, I can, you know, to make her life, daily life better.
Oh, thank you. All right, I'll take a minute to look over and I'll be right with her.
Okay.
I'm about to see Lindsay, and as I'm going through her chart, I immediately realize there's damage to the peripheral nervous system, and there's a plethora of symptoms that can come around with a disease like this. I have Miss Lindsay. Hi, Lindsay. Dr. Kolon.
Lindsay, nice to meet you.
Hi, I'm Scott. Yes.
Nice to meet you.
Me too.
Right on
All right.
in.
All right.
I love the bedazzled cane here.
I figured if I have to use it, it should be cute.
I'm gonna have you take a seat in that farthest one.
Okay.
And right, Miss Lindsay, right in front of me.
Awesome. My lady.
Thank you, sir.
All right. Right away, I took a look at your
Yeah.
paperwork here, and I see you have Šarko-Mari-Tutovom syndrome.
CMT.
CMT.
Yeah.
Much easier,
Much
right?
easier.
Right.
So obviously, this is a disease of the peripheral nervous system.
Yes.
It affects the lower extremity, but can also affect upper extremity as well.
Yeah. Also, this disease pulls me in, and so just holding all of it right here.
All these little contractures that are happening. Describe it to me in your own terms, how you feel. Is it lack of sensation? Is it dull, numb, tingling, maybe like all the above?
It's all of the above. So it's lack of sensation in the tips of my fingers and the tips of my toes. When it hurts, it's definitely a burning sensation. So it feels like when you were a kid and somebody would do a burn on your arm, it feels like that, but in my muscle, like in my bone. An able-bodied person could walk around the same amount and feel nothing the next day, and I am like down for the entire day. My balance problem, even just walking around, it gives me that burn. It's not like I did some massive workout or something, you know, but it feels like I did.
So if I had to put a name to maybe what we're trying to do here today is create health, create wellness, get you aligned, get you feeling better, install that progression.
Just the idea of not being able to dance at my daughter's wedding and be able to do those sort of things, it's a big deal. These are things that a lot of people can just do and they don't think about. These are things that I have to think about all of the time. So being able to prolong and be able to, you know, be on my feet at my daughter's weddings is, you know, everything.
I would assume, I don't know, maybe the lack of independence to be able to do the things you want to do.
That's my biggest fear, is losing my independence.
I don't want to say this to be cheesy, but I think part of me as to why I work out is because I always want you to feel like you are safe.
Yeah.
Oh, it sounds like you found a good one.
I did.
I love this.
I did.
It's a
He's
perfect
awesome.
match, guys.
Yeah.
Put that right there. Keeping that in my heart pocket. Super cute. All right, if you don't mind, I'm just gonna have you turn so I can evaluate your spine facing me. Yeah, okay, Mama. Mama
tight.
Bear's got,
Yeah,
lot of pressure.
yeah, she needs a little bit of love, but.
just you saying that makes me feel better, like I'm not imagining it.
No, you're not. She's lopsided, her hips are misaligned. She's got this forward lean in her upper back, which creates this jutting of the neck. So it's no wonder that she has all the tension in her shoulders. Oh my Lord. We're gonna have some fun today, girl. I know you're holding here, but I would also look right into between your shoulder blades here.
Okay.
It's just adding up now at this point. And then we have our foot drop that we have to take into account, because now the foot drop is going to create an imbalance in the pelvis, the sacrum, lower back, and just how you function. Do you ever get low back pain?
Yes.
Okay. When we talk about a progressive disease, this does not go away. It's not going to get easier for her. So my goal with her walking out the door today is just relief, relief, relief. For me, as a chiropractor, I look to the whole body, the whole spine. So we're going to get everything tuned up from top to bottom, because relief is going to be exactly that. Connecting every dot in between, not just the areas you're experiencing symptoms. We need to look at the causation, and we need to look at decreasing nerve interference and getting as much relief as possible. With CMT, there's damage to the peripheral nervous system. Her brain is not sending the correct signals, so obviously there's a loss of function. So I want to look to the whole neck and the whole cervical spine. Does that sound good?
Yeah.
Love it. Woo! Are you excited?
I'm very excited, but I am also very nervous.
Okay.
I'm excited, super excited.
I am too.
So I worry about Lindsay every day. She's the center of our universe, you know, the girls and I. So she's the strongest woman I know, but she's also a little fragile.
If you don't mind, face down for me, girlfriend.
Just.
Yes.
Right.
However's most comfortable for you. And I'll kind of even show you. Look at her body right now. You can notice immediately, right, that she's turning inward here on this ankle, and even how her shoe wears is different.
She wears the one side down real fast.
And it's because of that compensation, because of the foot drop. You with me?
Yeah, yeah.
Okay. And this is just a little bit here. Now, here's the area that I was talking about earlier. Oh, my goodness, girl. Take a big breath here and let it out. There you go. I want to move with your body.
Oh, wow.
How'd that feel?
Amazing.
Okay?
Yeah.
Take a big breath. I want you to drop that right shoulder all the way down to the ground. Let that arm just hang. Let it hang, let it hang. There it is, right there. Oh.
Those are involuntary, strange noises I'm making.
Look at her booty. This is a chance to look at the booty. Okay, yes, absolutely. And you can see how she's tilted or sloped downward, right?
Yeah, that's not the table.
Exactly.
Yeah,
and so ideally, as a chiropractor, right, we want to kind of take the pressure off the back so that all this can function a little bit better, and also give her relief in the low back, because if I'm walking around like this all day...
Just seeing that, I mean, wow.
It's crazy.
Yeah. I've never noticed that before or paid much attention to that. It was crazy for me to see that.
This hip is just screaming at me. Do your hips ever feel it?
Yeah, hips are a big thing.
This is one of those times I'm gonna say, massage your wife's booty. There's just so many beautiful connective tissues and muscles within the glutes and how they connect to the lower back, that just by treating this one area on her, it's gonna give her so much relief and so simple for you to do. And like I said, hey, gives you a reason to touch her butt.
Is there some kind of form I can take to work? Say, hey, my wife needs me right now. I'll be back. I mean...
I feel like you do that enough.
It's never enough.
It's never,
It's never enough.
All right,
Yeah. You got me on the butt thing. I can't... All right.
Sure, babe. Doing these. I also think it was really important to address things with Scott and let him see what's going on, because there really are a lot of things that he can help that can give her simple relief. C1, C2, C3, C4 from one side to another is much worse versus C1, C2, C3, C4 here. This
I can tell when you do that. Yep.
Lindsay's neck was like rubber bands. It was so taut. It was like pulling. I want you to do me a favor, okay? I want you to try and just wiggle your thumb for me. Oh. There you go.
That's fancy.
How you doing? I love it.
I'm over here
He's
like,
over here
like biting my nails.
She's come more calm than he is,
Yeah.
Oh, my goodness. Okay, here we go. So you're really caught at the bottom of your neck right there.
Wow. I can hear it. I mean, it sounded like just crack, 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 like all the way down. And it was like, you know, fireworks. That's the greatest feeling ever.
Give me a little hug just like this for me. And I'm gonna do this for you. Okay, how are we here? Every step of the way, I'm just gonna ask you.
Yeah, it's good.
Okay. Take a big breath, and I want you to look up to that ceiling for me. There you go, girl. Go ahead and just rotate this towards me now.
Yeah.
Take a big breath. Look up to the ceiling for me, all the way out. There you go. We're good.
Yep.
Right?
Yeah.
Okay.
Yep.
Go ahead and sit up. All right. How's that?
Oh, wow. That's nice.
Feel
Yeah.
less
I
pressure?
feel, yes. In here, a lot. You go through these pains for, you know, your whole life, and then once you get a little relief, you realize, wow, that was really bad. You know, I mean, it's really bad.
We've done the alignment, and then I also want to introduce you to our physical therapy assistant. We can try strengthening some of the postural things and see if there's a way we can maybe give you some homework to go home with. I am very confident that we can give her some homework that she's going to be able to do, you know, 2-3 times a week. And the goal is going to be working with her strengths, not against them. Miss Yona.
Hi. Hi. Lindsay, nice to meet you.
Nice to meet you.
Scott.
Scott,
Yeah,
Yona, nice to meet you.
She does all of our functional physical therapy here in the office.
Go ahead and have a seat right here.
Absolutely.
The hardest part about CMT for Lindsay is the progression. The hope in increasing her posture and giving her strength is that we're gonna stall some of that progression.
And try to just press in those fingers together to flatten them as much as you can.
But also, we're still looking to do the small wins, how she sits at the desk, how she functions as a mom, and give her the relief that she wants.
You want to curl them and just go all the way down and hold that. 1, 2, 3. And then you're going to come back up.
I actually have a lot of hope. Let me see you get up, girl.
Yes.
All right.
The relief that I could see, you know, releasing from her body. You know, has she ever felt that before? Probably not. I get emotional because she's in pain every day. She just seems lighter.
Such a pleasure.
Thank
So
you.
much.
Honestly.
That was amazing.
Absolutely.
Absolutely. Thank you so much.
All right, let's go. Let's go do things. Just the relief is, you know, we've said that word 100 times today, but that is truly the best way that I can describe it. So I feel like going to a chiropractor, it's just going to keep prolonging and helping me get through the pain that I have every day.
Look at you.
Yeah, I'm basically running.
Yeah.
I'll hand that over to Dr. Kolon, and she'll be right with you, okay?
There you go. There you go. There we go.
Dude, that was crap good.
My name is Danny. I'm just having some sharp pains in my shoulder.
Hey y'all, this your girl Danny with Be In My Radio Show on W1.5 PRK. Woo, y'all, my neck is killing me.
I'm a big girl with big pain. I've never been to a chiropractor before, but I always wanted to do it. Like, I wanted them to shake me up and put me in the right position.
Danny, come on back for me. Well, hello, Miss Danny.
Hi.
Come right this way for me. I'm loving this Diana Ross big energy vibe going on here with the hair.
Thank you.
I sit down with Danny. She has the big hair, the big energy, and Danny has some big boobs. All right, so Miss Danny, tell me what brings you in today.
Okay, so I spend a lot of time on my phone texting, and I'm down like this, always on the computer. My shoulders are often hurting, and you know, I have big boobs.
Do you have nice big bajungas?
Yeah.
Can I say big bajungas?
Yes, you can say big bajungas.
What would you like to say?
I just say big.
Yes.
I wear a size 44 triple D, so obviously I'm not in the itty bitty committee. My boobs are heavy, and I often like do this, and when I need to do this, but it's hard because I'm dragging a wagon, okay?
So, have you ever thought about having a breast reduction?
No, I don't want to.
Okay. The reason why I bring this up is because if we can get you back, right, we can almost automatically help create some of the tension off the neck and the shoulders. But if we're not willing to have a reduction, that's okay. But I need to know where your headspace is at so I know how to fix it outside of that. Imagine putting a 10-pound sack of potatoes and walking around all day with that. You're not gonna be happy, and neither is your neck. All that weight is gonna push the neck forward, and over time, it can actually create that hump in the back of the neck. Ever seen a chiropractor?
Never in my life. I was actually discouraged to come see a chiropractor by my doctor.
You know what? I probably hear that more than you could possibly imagine.
Well, they did scare me when they said that people sometimes have strokes after visiting a chiropractor. And I was like, I don't want to have a stroke.
Okay. There are good doctors and there are bad doctors.
That is true.
And you are in good hands. Yes, I am gonna do the cracking and the popping and the adjusting that we all talk about. So yeah, you're gonna feel those sensations. I am gonna examine your spine. I'm gonna take a look at everything from top to bottom, and I'm gonna ask for your permission every step of the way.
I love this consent game.
I felt very comfortable with her. I felt like she cared about me. I felt seen. I'm excited to know that I could be put in the right position. She can help me with my shoulders.
As a result of the larger boobs, you're forward stooping here, right? So I have this forward motion. I'm gonna over-exaggerate it for you, and you're getting this hump in the back here, okay? This becomes more of the chronic problem, because if this continues, right, this hump that we have right here is gonna get bigger. And I know that you don't wanna be 80 with some big hump in your back, right? The reason why we gotta start promoting this good posture is because as I do that, you almost automatically see that hump decrease. Go back to your forward motion again. See the hump? Go back to good posture. No hump. I'm gonna keep going. Any low back pain?
No.
Okay. Any knee pain ever?
Sometimes, yes.
Which one?
Both.
I'm gonna have you take a seat. With the knee pain, obviously, things like doing the bike, okay, is a great exercise to help strengthen the knees, making sure you're wearing appropriate shoes.
I wear these heels every day.
Like all day, every day?
No, not all day, every day, but if I do leave the house and leave the computer, I am in heels.
Okay.
What?
We need to figure out a way to wear something more supportive for our knees that are paining us. I don't want to break Danny's heart by decreasing her fashion, okay? I'm all for fashion, but let's give some educational tools on maybe how to get more creative with our fashion. Maybe the creative side is to do what I did when I lived in New York City, right? Because I hated wearing heels, but I had to wear them for my job. And what I did is I carried a flat shoe, right? Something that was more comfortable and supportive for my shoe. If you can't wear a sneaker, which is my preference, but I'll take something. I'll take anything, actually.
Okay.
And carrying like my heels, like maybe in my big, massive purse. Baby steps.
Okay.
Baby steps, okay? Looking over Danny, it's clear that the main issue is gonna be reversing that upper cross syndrome. To do that, I'm gonna adjust her thoracic spine or her upper back and her neck and make sure we give her some strengthening exercises. By getting her adjusted and strengthening her muscles, we're helping to support the spine, improve her posture, and improve her neck pain. Let's go face up first, okay? Take your hands, interlace them, and put them right in your belly for me.
Okay.
Just like that. I'm just gonna move you, okay? Any pain with that?
No.
Okay. Any pain with that?
No.
Okay.
I'm scared.
Okay. I got this, okay? Now, what I want you to do is I want you to just wiggle that right toe just a little bit. One more time.
Oh, Lord. Girl. Okay, hold on.
That's it.
Okay.
Let it sink in.
Okay, wait. That was, okay. Okay. I can do this. I was not expecting that. I watched way too many chiropractic videos on Instagram.
Was it painful?
No, but I feel like there was relief in my shoulder for some reason.
And there it is. I haven't even gotten through the whole thing yet. All right, remember to have that feeling in your head. You're totally okay. And this time, look at her wiggling her feet already. She's like, I'm wiggling. I love it.
Oof.
That's good.
That's good.
Yeah. I'm upset that I was scared of that.
Girl, what I love about a first-time chiropractic patient every time is make them a believer.
Yeah.
That's the cool
I'm
part
a
about it.
believer.
I love it. The first-timers, I make them a believer at least 99.97% of the time. And it's just goes to show what we do. I'm gonna have you take a big, big, big breath all the way out. That's it. Drop your shoulders. There we go. I'm just putting a little bit of space into lower back. Less is more.
This feels like a roller coaster.
The chiropractic roller coaster?
Yes.
I'll take it.
When I got up from the table, I was like, ooh, you know, like, I didn't know I could feel that good. I felt like loose, a weight was lifted off of my shoulders, tension that I didn't even know was in my neck. I felt a relief from it. Oh, Lord. I wanna glide and prance. It's a good service. Thank you. I feel so great. I loved it, and I'll be back, okay?
That is the biggest compliment you can give me, girl.
Okay. I'm healed. Nice to meet you.
Have a great day.
When Danny leaves, she's walking a little straighter. I'm pumped. Her neck is more supported. Her shoulders are back, and she's feeling better. It's nice to see Danny walk out with her beautiful vaginas pain-free. I love a first-time chiropractic patient. That's my favorite every time.